The Nairobi Hospital continues to expand its medical expertise foothold and has now built 2 state-of-the-art outpatient centers. The opening of Warwick Gigiri in early 2011 and the opening of Galleria outpatient centers in 2012 respectively establishes Nairobi Hospital brand as a reliable and authoritative medical services provider. Is Nairobi Hospital rolling out an expansion strategy? If so, is the outpatient center the beginning?
Nairobi Hospital indeed is rolling out an expansion program. If I can take you a little back, we used to be only 199 beds. In the last 7 years, we have increased to over 300 beds. We have also opened 2 centers out of here, which we call our outpatient clinics. One of them is in Warwick, Gigiri. We opened that one on the 15th of March 2011. And the other one is Galleria Langata side, and that one was opened on 1st of August 2011. Our expansion comes with a strategic planning that is guided by the master plan of this hospital. And as soon as we have settled those 2 clinics, we will then think of the next point. However, it is good to say that the reason why we opened the centers was because we felt we needed to take service to the community that lives there. And the fact that they have grown, both of them, shows that yes, indeed, we heard what people were saying and we went out to meet their needs.
What has been the contribution of these outpatient centers to communities where they are located?
I would be very comfortable to say it has done them well. The reason is, like the one in Warwick, we listen to the community there, what is it that they need, and they have guided us in opening new clinics for them. Before, we had A&E department where they would come and be treated and go home. We had a pharmacy, a laboratory, we had a radiology department and physiotherapy. But now we have gone ahead and opened a family health clinic, baby clinic, well woman clinic, and these clinics are growing. We see more numbers every month. So in that aspect, we can actually say, yes, they are growing and the community is being served well.
Any plans to have more outpatient centers in the future?
When we have finished with these 2, or they are able to stand on their own, then yes, we can expand within Nairobi or even outside Nairobi.
The Nairobi Hospital has expanded its infrastructure to develop an outpatient center in Gigiri area. Situated about 8 kilometers from the CBD, the Nairobi Outpatient Center at Warwick started its operation in early 2010. At the Warwick Outpatient Center, finding parking for your cars is no longer a headache, and ample car parking is available.
Welcome to the Nairobi Hospital at Warwick Center, Gigiri. My name is Susan Kieti, the unit manager of the new center. At the new center, we see clients who are coming from the Gigiri environs. Just to name a few, Kitusuru, Nyali, Runda, and Kiambu Road. We are situated at off Limuru Road at the UN Avenue and also between the Northern Bypass. Please join me to take a walk to the center. This is the reception where the patient comes first. It is the first contact at the center. At this reception is where we give direction to the different service areas in the center. It's also where you make inquiries as a customer what is happening in the center, and it's also where we get feedback from the customers. We are now at registration. Registration is where all patients who come to the center, they are registered, and the registration we give you a card which has a number, a registration number. This card can be used in outpatient centers and also in the main hospital. At this area also, all patients who come to see our A&E doctors, that is the casualty doctors, and also the clinic doctors, we open up files for them. These files contain the medical information for that patient. They are kept confidential, and all results which are generated are also put in the same files. For patients who wish to go away with their diagnostic results, these are the lab reports and also X-ray reports. They can collect them from here and go home with them. At this point also, the biodata collected is put in the IT system, which can be shared in the whole of Nairobi Hospital. Now we are at pharmacy. At the pharmacy here we serve prescriptions from our doctors, that is the casualty doctors from inside and also from the clinics. We also serve prescription from consultants. These are doctors who prescribe from outside, and then we serve the prescription from here. We also do brown bag services. This is when you have drugs at home and you need to be explained to on how to use them and also their interactions. So you bring them to the professionals and you are taken through the whole process. We also do importation of drugs. These are drugs which are not available in the country, and we do this on request. The institutions which are around, they also order drugs from our pharmacy here, and we are able to serve their clinics. This is the cashiering point. At the cashiering point is where all payments are done for services, and at the cashiering point we accept cash, debit cards or credit cards, and we also do corporate charges, that is insurance. The cashier will give you a voucher or a receipt after you make your payment, and then you proceed to the services you require. This is our reception area, the waiting area for pharmacy. Once you hand in your prescription to the pharmacist, then the pharmacist will enter it in the IT system as they process to dispense the drugs and call you and explain to you how they are taken. Then you take a seat here. You can take a magazine or any reading material which is on the racks, or you can catch up with international news. This is the play area for children. When children come to the center and they come with the parents, as the parents go to transact at the reception or at registration and the cashier, the children come and play here. This is a safe place for them. They can also wait for treatment here. When the doctor is ready for them, they are called in to see the doctor. It is a safe place where they can also watch cartoons of their choice. This is the A&E or the casualty reception area where you wait as you wait to see the doctor. When you are given a receipt by the cashier, that receipt you give it to the nurse, and the nurse will take you to the triage room. At the triage room, it is where the nurse will take your observations. This includes the blood pressure, the temperature, the pulse, and also your history of what you are presenting with and your past medical history. This is documented in your file, and that file is taken to the doctor, where the doctor will see you, you consult with the doctor, and the doctor will examine you. Come with me to the nurse's desk. This is the nurse's desk. At this desk is where the nurses will do all the documentation and communication to external departments. This includes communication to consultants and also communication to the main hospital. On this area we have consultation rooms which are mainly for pediatric. From the far corner there we have 3 consultation rooms. On this side we have the treatment room. And the treatment room, mainly what happens here is we give travel vaccines and also do procedures on this area. We have the adult consultation rooms, which are on this side. On this side, we have also the resuscitation room. The resuscitation room is where we see patients who come in who are unstable and who are not able to walk. Is where we stabilize them. These patients come from the car park with our assistants, either on a wheelchair or on a stretcher, and they come straight to the resuscitation room. What is in the resuscitation room? We have 12 lead ECG. We also have resuscitative drugs, and we also have intubation equipment. We can support the life of the patient until we take the patient to an ambulance, which will transport the patient from here to the main hospital. We keep in contact with the admitting consultant who is going to take care of the patient in the main hospital so that we can have seamless care from the center. On this area also we have an observation room where we keep our patients who are not too acute and yet they are not also well. We observe them for some time and then we make a decision whether to release them to go home or we can admit them. We also have a dressing room where we take care of patients who have wounds or we need to remove stitches. That is where we do the dressings for our patients. This is the reception for laboratory and radiology. Once you come from the cashier with the voucher or the receipt, it is presented here to the receptionist. And then your request form is taken to the laboratory or radiology. At the laboratory, the sample is drawn by the technologist who is there, and then your sample is processed. The results, once the results are out, are sent to our casualty doctors if that is where the request was coming from. If it is from external consultant, your doctor, those results will be sent to your doctor. Our laboratory is equipped with the state-of-the-art equipment and is a subsidiary of the lab in the main hospital, and we perform a wide range of tests which are also done similarly in the main hospital. Here we have radiology. Once you come from the cashier, you present the request form and the receipt to the radiographer. The radiographer will check you on the system which is connected to the cashier, and mark you arrival. The radiographer from there will take you to the room for examination. We have X-ray, CT scan, and ultrasound. Something unique about our radiology department is that we are connected to the main hospital through PACS. PACS means Picture Archiving Communication System. Once the picture is put in PACS, the radiologist in the main hospital is able to look at the picture, interpret, and then give a report. That report is put in CARE, that is the IT system we are using as a hospital, and that report is printed and given to you by the radiographer. That saves the time for you to travel to the Nairobi Hospital or to wait for a report for a long time. This promotes efficiency for the center. We are now at Physical Medicine Center or Physiotherapy. You bring your request to the physiotherapist. The physiotherapist will give you an appointment. The treatment given here is electrotherapy, manual therapy, and exercise therapy. During this treatment, you'll be exposed to different machines, and these machines are to make you better. The care given here is personalized because once you start a session with a physiotherapist, you finish your session with the same physiotherapist. A report is given then to your doctor to be able to assess you for review. We are now at the clinics. We hold clinics on different days of the week. We have a pediatric clinic or a children's clinic which are run by senior registrars and consultants. We also have a well-man clinic where you can be able to do routine tests to monitor your health. We also have family health clinic. We have obs and gynae or obstetric and gynecology clinic, and we have antenatal and postnatal clinic. For postnatal antenatal clinics, we monitor the mothers when they are antenatally, and we admit them in the main hospital for delivery. We can also deliver here in the center in case of an emergency. For baby clinic, We give vaccinations from 6 weeks to 9 months, and we monitor the growth and also teach the mothers. Our vision as a center is to be the leading healthcare institution in the region by providing world-class treatment and service. We intend to achieve this mission by offering all our patients best care using advanced technology and in an atmosphere of trust, safety, and comfort. We are dedicated to the patients by offering them and their families efficient service and great value for their money. We are devoted to providing a warm, friendly, and caring environment in which all our patients can recover and feel comfortable. We inspire all our staffs to achieve the highest development to their extraordinary and keep the best careers. We pursue superior quality performance and quality in all we do to build and preserve the hospital's clinical, organizational, and financial strength. We recognize the value of partnering with internal and external partners to accomplish our goals.
Our roads lead to Langata Road, where Kenyans have a reason to smile. Development of Galleria Mall, a modern metropolis shopping mall situated 12 kilometers from Nairobi City. Nairobi Hospital is a developing institution with a state-of-the-art outpatient center.
Welcome to the Nairobi Hospital Galleria Outpatient Care Center. We are situated on second floor of the Galleria Mall. The mall is situated on at the junction of Langata Road and Magadi Road. So the patients can get to the center using the lift or the staircase. Now once they come in, they arrive at the reception area where we have a comfortable place for them to sit. We also have a number of journals and magazines and some readings for them as they wait. When they first come in, they will be welcomed by a receptionist who is going to, first of all, identify what it is that they require. After you've been welcomed by the receptionist, she will direct you to the medical registration counter. At the counter, you will find a team of dedicated medical record staff. They will first find out what service you require and if you have been seen at the Nairobi Hospital before. If not, you'll be asked to fill in a form which gives your personal details, your address and telephone contact. The reason being, we do follow up on patients. Once you have filled the registration form, they open for you a file. Every patient has one file. This is to ensure that on follow-up, we are able to track your previous visits and then you're able to get quality care by a person who knows your previous history. After registration and opening of the file, they also retrieve records of investigation reports. This includes lab reports and X-ray reports. They put in the file so that when you come back for the next visit, you will be seen with all the records ready. After registration, the staff will direct you to the cashier's counter. At the cashier's counter, the staff there will request to know how you wish to make your payments. Now once they have you have verified how you're going to pay, they will take you through the process of payment. They will receive the monies and give you receipts. They will also help you in filling the admission forms if you require admission to the hospital. They will also contact the health insurance companies where need be. Once you have finished with the payment for the services, you will be requested to have a seat at the reception and then you will wait for not more than 5 minutes for a nurse to come and take you to a place we call triage. Triage means sorting out. At triage, the nurse finds out what the problem is. She takes the history of your complaint and she takes your vital observations. From the information you give the nurse, they are able to decide whether you need to be seen by the doctor immediately or whether you will wait. Basically, the wait is not more than 15 minutes to see the doctor. Depending on the seriousness of the condition, sometimes the patients are taken immediately from triage to the treatment area. This depends on the complaint. Otherwise, you'll be asked to sit at the reception again and wait to see the doctor. The wait does not last more than 15 minutes. After triage, the patient is directed to come to the Accident and Emergency Center. This is where they will find doctors and nurses who are trained to handle emergencies and cold cases. They are able to treat newly born, the school age, the young adults, the adults, and even the older population. We are able to treat illnesses which range from a cold and a flu, heart attacks, accident victims. We are able to treat the whole range of illnesses at this center. Now, there are several treatment rooms. We have a procedure room where we are able to do small surgeries, like suturing of small cuts or incision and drainage of small boils. We are able also to do dressings. We have several consultation rooms. This is a room which has all the diagnostic equipment, which enables the doctor to be able to investigate and see what is wrong with the patient and give the adequate treatment. Other than that, we also have a resuscitation room because we do get people who have collapsed. They are either not breathing or their heart has stopped and they require to be resuscitated. We have all the equipment to be able to revive the patient where possible and even to manage them until we are able to transport them to the main hospital, ICU, or even the theaters. This is the pediatric creche. We recognize that children need to play, and therefore we have provided a safe playing area for the children who are unwell come to visit the outpatient center. While the parents are doing the paperwork, we have provided toys so that the children can feel comfortable and not frightened by the hospital environment. At the Galleria Outpatient Center, we have a room which is designated for seeing the pediatric patients. Pediatric patients age group is from the newborn to 13 years old. So once they have been waiting in the pediatric creche, they come here and they are seen by the doctor, where if any investigations are required, like the laboratory tests or x-rays, they'll be seen and then they'll be sent for them. Once the results are ready, they come back and they are reviewed in this room. The difference between this room and the other consultation rooms is that the artwork is appealing to children. The idea behind it is to make the child as comfortable as possible and to reduce the fear of being in hospitals. This is the X-ray department. In X-ray, we have 3 types of tests. We have the X-ray, which is a fully digital one, which means the patient doesn't require any cassettes. We also are able to do the X-rays and send them through the picture archiving system to the Nairobi Hospital Radiology Department, where the X-rays are seen by a radiologist, and within half an hour to 45 minutes we get the reported X-rays back and the patient is seen. We are also able to scan and send the reported a report to the doctor who is away. That is like when consultants send from areas out of the hospital. So patients don't have to wait for their X-rays. They can be seen by their doctors at their convenience with reported X-rays. We also have a CT scan. The CT scan is able to do bone mineral density. We're able to do any CT scan of the body. You're able also to do virtual colonoscopy. We can be able to do a whole range of tests that are required through the CT scan. The third test that we have an ultrasound, which is 3D, 4D. We're able to see images of unborn babies, the fetus, in real time, and it is colored. This is the physiotherapy center. When patients come, some of them may have complaints of muscle aches, general body pains. Sometimes it can be following a surgery of a bone. So we send them to the physical medicine center where they find qualified physiotherapists who are ready to treat them and manage their complaint. Other than backache, sprains, or rehabilitation of fractures, the other treatment that is provided is rehabilitation following a stroke, or occupational therapy also for children who have cerebral palsy. We also train patients who require better joint movement, that is following diseases like Guillain-Barré or neurological disorders like poliomyelitis, if that happens. So there's a variety of equipments that is available, from electrical therapy to shortwave diathermy to hot packs. So all these, the physical medicine staff use them in order to improve joint movement and to reduce pain. This is pharmacy, it's the patient's last stop. Once the medication has been prescribed, they can come and get it from the pharmacist. The pharmacist will give you the prescribed medication. They will tell you what this medicine does. They will tell you what to look out for and for how long this medication should be taken for. The vision of the Nairobi Hospital is to be leaders in healthcare provision in the region. I have a team of dedicated, professional and well-trained staff who are ready to take care of you whenever you need quality healthcare.